So I'm here at ISNTD Co-Infections and Comorbidities here in London, and I'm joined by a special guest, Dr. Peter Derek Christian Leutscher from Aarhus University. Peter, you've just spoken in a session this afternoon, really looking at the challenges in terms of HIV and genital schisto from a Zimbabwean perspective. Would you like to just elaborate a little bit on that for our viewers?
Yes. What we have done is that we have for a number of years been working on Schistosomiasis, which is a parasite disease, and it's a genital manifestations, both occurring in males and females, and it's today we have more and more evidence that that Schistosomiasis is a risk factor for HIV transmission, in addition to the other morbidity that this parasite disease causes. So what we are working on is Schistosomiasis as actually a neglected risk factor for HIV transmission. We have many other risk factors in play in Africa, like STDs, but there has not been that much attention, if any at all, on Schistosomiasis.
May I ask you, I mean, obviously FGS is quite a focus area today for today's female genital schisto, and as you mentioned, the increasing prevalence rates for HIV infection. It's kind of a key issue in this particular session, and we're covering that in terms of the conference. In your opinion, why is it so underreported? Why is it still not really considered or it's just about starting to be considered a risk factor for HIV?
Well, I think for many reasons. First of all, because the disease manifestation itself has been neglected, even among pathologists. This is Schistosomiasis, female Schistosomiasis is due to infection with Schistosoma hematobium, which is normally, in most cases, for decades have been linked to urinary Schistosomiasis. But actually, not very much attention have been on the genital manifestations, and the genital manifestations are as commonly occurring as the urinary tract manifestations. So the proper name for this entire disease entity is urogenital Schistosomiasis. And we know that it's difficult to access the genital manifestations because it requires a pelvic examination. And in most places we are in a rural area, rural setting, and we do not have access to do pelvic examinations, which actually requires not only pelvic examination, but also in most cases colposcopic examinations, which means high technology. So it's for that reason, for diagnostic reasons, we have had a problem about having enough focus on FGS and to describe the manifestations of FGS. But now we're coming on, and there's an increasing awareness, and we have the studies, data from the studies coming in, and showing that this is highly prevalent among the women, and it causes a wide range of various symptoms for discomfort for the women. So this is one part of the explanation why it has been kind of in this situation, by the way, it has been neglected because we did not have the appropriate diagnostic tools for doing it. Secondly, when we want to go further and see it as associated to HIV, it's like we are in a kind of often end up being separated. We have the pathologists working in their field, and then we have the HIV people working in their field. And unfortunately, there is often a lack of communication and lack of interdisciplinary approach between the two fields.
So moving from the rhetoric of multidisciplinarism and into a real sense, what do you think's needed? I mean, I totally agree with what you said. We formed as the ISNTD on the basis of we wanted to break down the walls, the silos between the academics and the NGOs and everyone together. And that's what today is actually all about. This particular, it's about making worlds collide.
Exactly.
So you'll see session after session with so many different points of inflection and juxtaposition built into it that people are just thinking differently. Yeah. That's what we're trying to achieve. Mm. In your opinion, what needs to be done? What needs to be done to move from the rhetoric of multidisciplinarism, multisectorialism into a real, multidisciplinary world approach?
I think that it's first of all the awareness of that there is a problem, and I think what this initiative is, we should have much more of those initiatives, and actually we should be almost obliged to, when we are working as a specialist in a certain field, we should be obliged to say, this is my area, and what other areas are linking up to this area? I think it comes to the specialists themselves, whether we're a pastologist or we are HIV or we in another field. We are obliged to ourselves to think as researchers, to think in a much broader context than we're doing today. And I think that also from the international community or in the international funding community, I think that there should be more calls on research having focus on how diseases are linked together.
Yeah. I guess what we're gravitating towards is we've learnt to read the letters of an alphabet, but have we developed a lingua franca, a common language between all the disciplines? Do you think, what form do you think that common language might take? Will it be an immunological basis of, the host pathogen framework? Will that become the center, the language that everybody understands and can talk with each other? What do you think, how will it manifest itself?
I think it could manifest itself in many different ways. Immunology could be one approach. It could also be the social science approach. I think we should stop up and say the way we have been elaborating on research until now. Do we really get to where we want to get to, and kind of review our research strategy? I think this is what is highly needed, and I think that for that purpose, research institutions around the world should have that in their agenda much more than today.
And perhaps we're moving to that as an inevitable conclusion with the further extrapolations in terms of globalization and everything like this. We're moving to far more convergent kind of space. Maybe it's an inevitable conclusion. From Aarhus University and your particular department's perspective, today is really designed about partnership building. Mm. It's designed for progress through partnership, and you've seen such a diverse range of, hopefully quite a diverse range of people from music, from biology, pharmacology, social sciences, economics. Everyone is here. They're talking about what type of partnerships would Aarhus University, you in particular, look to be forming, and can they contact you directly as a department or?
Yeah, absolutely. I would say that in this area of genital schistosomiasis, our main focus is, of course, about the disease and how to prevent it and how to treat it itself. But I think that we need this stronger collaboration with partners from, for instance, in the HIV world. It's very important to have a closer collaboration with the HIV community. We have been working on genital schistosomiasis, and we have been able to publish our results and to get out with it. But it still remains striking how little we actually, the progress, the lack of progress we actually are not fulfilling. So I would like very much to see that to be open and to have a much closer communication and contact with in the fields of not only on HIV, because it's a matter of sexually transmitted diseases. It's a genital sexually transmitted diseases is a differential diagnosis, and actually the approach should be that if you have a person living in a schistosomiasis endemic area, this person should also be treated against schistosomiasis and STDs at the same time. So it's the understanding of that you should have this, putting this approach together. And I see it definitely also, so this is an element of reproductive health, to have an understanding that in the field of reproductive health, you have many topics involved, STDs and genital. You also have to look into the schistosomiasis as a pediatric disease, among many other pediatric diseases. So it's whatever I have colleagues and out there who potentially can see that could actually be a reason for having a closer contact. We should have that contact.
Oh, good. So that's a very encouraging, an open mindset and a very positive mindset in terms of trying to achieve true multidisciplinarism. That's very encouraging to hear, Peter. I appreciate that a lot. Coming into your work for a second, you've outlined the open desire to, or the desire for open frameworks in terms of partnerships and academic collaboration. Coming to the acute experiences you've had in Zimbabwe, as an example, what type of partnerships in field with the local actors and players would facilitate your work in terms of conduction of HIV and genital, the urogenital schisto? What kind of local partnerships and
that will definitely be that we are conducting those field studies. We have showed that the impact of treating genital schistosomiasis in men co-infected with HIV, and we have shown that if you treat with praziquantel, which is the drug of choice for schistosomiasis, you achieve a significant decrease in viral load in semen. And we know that the amount of virus in semen is a major determinant on how infectious you are towards your partner. So those findings should be shared with our colleagues in the field working with the HIV patients. And those findings should also, in order to be able to work together, see how can we use those results in a strategic way? How can we, because we absolutely convinced that those findings could have a major impact on prevention of HIV, spread of HIV. And if it is just a matter of at least to have the understanding that a single dose treatment with praziquantel can have an enormous effect on spread of HIV, then we should have this as a tool, make use of this tool, but we cannot do it alone. We have to do it in the overall strategy for prevention and control of HIV. So we really need to have this collaboration with the people in the HIV field in Zimbabwe and other places where schistosomiasis and HIV is co-endemic. We also need to work very closely with the expert, with the community working on STDs, because many of the symptoms of genital schistosomiasis is similar to the symptoms of STDs. So in order to have the full potential scale of this knowledge, when the person in this area suffering from symptoms from the genitals, those people should be treated for the STDs, but at the same time also for genital schistosomiasis. In other words, the drugs against STDs should be standing on the shelf next to the drug against schistosomiasis. So we have this understanding, and all this HIV and STDs. This is really what we need to have focus on in a large-scale primary healthcare program.
And when you say collaboration, at some level or other, the data is going to be shared between HIV programs and your own approach, as an example. At some level, there's going to be data shared. What's your view on the future role of NGOs in affected countries such as Zimbabwe? This could be mapped out to Uganda as an example, other areas or foci of FGS as an example, leading to higher prevalence rates in HIV. So quite a few different African countries or target areas you could map this into, I'm sure. The question is that, what do you see as the question is, to map something like this out, you're going to have to underpin it with data, and that data is going to come from existing, at some level, from existing NGOs. So what's the future role, in your opinion, of NGOs working in HIV, or indeed any other area in and around FGS that impacts that, from a data perspective?
From a data perspective, I think that it is very important that the NGOs, those who are working in the fields and addressing those issues, that we feed them with this information, so with data. And it's very important that we create an agreement by which that the HIV community and the community involved in genital schistosomiasis and urogenital schistosomiasis actually are providing information that fits together, because otherwise it may confuses the NGOs and to understand what is the impact of this in compared to this. So I think that we have obligations as researchers to actually jointly to come up with an agenda and to translate our data to some kind of useful knowledge that can be adopted by the NGOs for them in order to make a better strategy.
That's a very good answer you've given in terms of the relationship between the NGOs, the future role in terms of data generation, and the relationship to research groups. In terms of your work in Zimbabwe, I'm making the assumption that it could be mapped out to different foci in that region, i.e. Different areas of co-endemicity in terms of FGS and HIV, different countries. What would be the role of governance in terms of facilitating your work in different countries?
The role of the governance is it's so very, very essential because all this knowledge and all those data will have no impact whatsoever if it is not translated into the public health program, put into the given national guidelines, this will always there will be a risk of having this as an academic, nice to know knowledge, but the major challenge, or maybe you could turn around and say the major opportunity, is to have this knowledge translated and used and adopted in the existing and guidelines for, in this case, for prevention of schistosomiasis, control and prevention of schistosomiasis and HIV comes together. So also at governance level, it requires that different sectors of the governance are actually also collaborating. So again, we have an example of, it's just showing the necessity of having this interdisciplinary collaboration between different partners and also at government level. But we have to emphasize the importance of having the government in this.
Absolutely. And I think that echoes a lot in terms of issues around access to rural areas, access to communities, and not just the rebuilding or augmentation of the sovereign healthcare system, but also the actual workings mechanically in terms of getting to the patient cohorts.
Absolutely, absolutely.
So, and I hear you on that. So, I mean, we've covered a lot of ground there. I'd like to say thank you very, very much for coming and presenting, as well as making some time for this.